Hi guys, Tara Scott from Revitalize. I'm here with Dr. Rika and we're at a conference together here in LA and we just wanted to put together some of our takeaways. We were discussing how girls often are put on birth control pills for symptom control, which I don't personally agree with, so that led us to say, well, what isn't optimal or another option for birth control? And we talked about the copper IUD. So in my world, I think, well, it might be okay because there's no hormones, but Dr. Rika reminded me that there might be some other issues. So why don't you share what you told me?
So one of the common problems that comes through my door, other than, I see a lot of women, but, anxiety and depression and mental health disorders come through the door not too infrequently. So it is a very common symptom. And one of the imbalances you can see is an imbalance in the ratio of copper to zinc. So some of that is exposure to copper or not enough zinc, but there are actually predispositions, something called pyroluria, which you can measure in urine testing, where patients can't hang on to zinc, and it makes that imbalance. So unfortunately, you can have a young gal that comes in and has two issues. One is that she wants birth control, and she has underlying anxiety. And lo and behold, you say, well, I don't want to use any of these hormonal controls because Dr. Scott and I are talking, and there's not great options. I mean, there are options. And if you wanted to use non-hormonal, you would think about the copper IUD, but you could potentially worsen the underlying situation.
So are you saying that the copper IUD can be absorbed systemically?
Yes, so it can be absorbed systemically. So you're going to get copper from either copper water pipes. They use it in chlorinated swimming pools, so it's an additive that's in that formulation. So those are the top two. And then, of course, the genetic predisposition to having high copper. There are some other disorders that render you with high copper, like Wilson's disease, but that's pretty rare. So you're looking at it's got to come from some other source, and a copper IUD would certainly be a source, and you'd hate to place one.
Yeah, so how do you test your patients for that?
So that's a good question. So I look at 3 markers. So you can do this through any regular lab, like LabCorp, which is my preferred. So I look at plasma zinc, or serum zinc, and I look at serum copper, and then I look at a protein called ceruloplasmin. And ceruloplasmin is what binds copper, and ideally you want your copper minus 3 times your ceruloplasmin to be less than 30. I think that's the way it is. But I have a little calculator I use. But you want a percentage, so you want the free copper percentage definitely under 25%, because all the copper in your body, some of it is bound to a protein, and that's not going to be worrisome. What's worrisome is the free floating copper. And so it's not only with mental health disorders, but another thing I treat is loss of memory, and it's very inflammatory to the brain. So not only giving you anxiety, depression, etc., but then to brain function in general. So
that's awesome. That's something that as a trained gynecologist I'm not aware of, and it's not my first thing to think of. So a simple blood test at a routine lab. Do you have to do the micronutrient testing?
I do that in general. No, to figure the ratio, no, you don't. So micronutrient testing is a form of testing that's done looking at the stores of nutrients in the white blood cells, and that's a 3-month average. And so that's important for other reasons, because so many of our vital chemical pathways that make us vibrant and keep us healthy are dependent on what we call our nutrients, our vitamins and our minerals. So I do use it for different purposes. Yeah.
So if you're a woman of any age with anxiety, depression or cognitive issues,
or cognitive issues, you want to explore that.
So if you're in the Chicago area, you want to talk to Dr. Rika, and if you're in Ohio and Akron, contact Revitalize. We can get this testing ordered.